Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why.
Good evening, everyone. I am Dr. Rogers Kane, your usual host. I am here with a couple of people this evening. Our topic tonight is on sickle cell anemia. But before I get started, I would like to introduce our guest. We have Fredriana Copeland Webster and Miss Selena Webster Bass. They are related for those that want to that may be curious. How you guys doing this evening?
We are wonderful, Dr. King. It's a pleasure to be on the Pause for the Truth broadcast. Excited to be here.
Well, we're excited to have you. What about Miss Copeland Webster?
Yes, I'm so happy to be here. It's a pleasure. Thank you for having me.
You're most certainly welcome. We do have another guest. They're having I guess it would be a ghost since they're not here. We have another guest that will be attending. They're having a little difficulty signing in, but they will be here. Ordinarily, Miss Turner would like to ask, how's the weather? Aren't you guys loving the weather? But I don't think that will hold true this evening because it's storming outside my residence. Caused my wife to go lock herself in the closet since she's thunderphobic, lightning phobic. So, but with that being said, I think we're going to have an exciting show this evening. Very informative for sure. And Dr. who's now a physician, the last time I talked, not a physician, I'm sorry, who is a doctor now, doctor of ministry. Last time I talked to her, I don't think that title held true, but we want to congratulate her in her accomplishments.
Thank you so much.
You're most certainly welcome. Selena is our special guest host that will be playing the role of Jocelyn Turner. And if I left it up to Miss Turner, she can say nobody can play my role, but okay. If you want to say that, that's fine. But I think Ms. Webster Bass, Dr. Webster Bass, will do an excellent job with what we're going to do this evening. So without further ado, I would like to introduce Dr. Webster Bass.
Thank you so much, Dr. Kane, for having Fredriana and myself. We are really excited about this broadcast because it leads up to World Sickle Cell Day, which is June the 19th. And so World Sickle Cell Day and Juneteenth are on the same day. And so we thought it would be a wonderful opportunity to bring awareness to sickle cell anemia and to the lived experiences of people living with sickle cell. We thought that's really important. We don't want to just talk about the disease itself, but also talk about what people living with sickle cell experience every day, particularly in contact with the healthcare system and just in their everyday living as caregivers, as Fredriana is a young adult in college. So so we just want to share about the importance of knowing your sickle cell status and what the disease is. So I am Reverend Dr. Selena Webster Bass. I am the executive director of a nonprofit, the Richard Webster Bass Health Institute. And that nonprofit is named after my son, Richard. Richard passed from sickle cell in 1999, and this is one of our educational materials. And that's actually a picture of my baby. He passed at 22 months of age, and so it was a really difficult time, but we are celebrating his legacy through the organization and through bringing awareness at various sickle cell events, conferences, and throughout the community. So this is Rainbows. It's a book of hope. and a book of sickle cell disease awareness for children, because it's important that children know about it and also have empathy towards those that are living with sickle cell. So this is one of our products, and that's my baby there. So I always like to honor him and honor sickle cell families. So
Dr.
Yes.
I want to, you get used to me just kind of interjecting something. Want to make sure we put in our chat box access to your organization's website. And so make sure we get that for Tyrone to put it in, and how the book can be, how we can get a hold of the book.
Yes.
Okay.
And so the website is Richard WBHI, that stands for Richard Webster Bass Health Institute.org. And you can purchase the book there for $20. And all of the money goes towards scholarships and for supports for sickle cell families. A lot of times parents are in the hospital with their children for several days, and they need meals, they need transportation, they need assistance with bills, sometimes even assistance with burials. And so all of that money goes towards supporting sickle cell families, and we give out scholarships every year for our sickle cell warriors. So, so please support us at richardwbhi.org.
Very good.
Thank you. I see our other guest has joined us. Rhonda, welcome.
Hi, how are you?
Wonderful. Loving that red hat. We're calling yes, World Sickle Cell Day is Redteenth for us. You know, it's Juneteenth for June 19th, but we call it Redteenth because it affects the red blood cells. And so we want to bring awareness to what the disease is, which it is a genetic blood disorder. It's not something that you can catch like a cold or by touching someone, but it is genetic. It's passed in the DNA from parent to child. And so normal red blood cells are shaped like a donut, and they're very flexible and move easily through the blood vessels. But in the case of sickle cell, they are that C shape or banana shape, and they tend to clump together, blocking blood flow. And so oxygen doesn't get to the tissue as it needs. And it affects every organ of the body, not just, a lot of times we hear about the pain, but the pain can be anywhere. It can also, be blockages in the brain causing strokes and other complications, from acute chest syndrome to issues with the spleen, enlarged spleens. So it's important that we really support sickle cell families. So that's a brief overview of what it is, but I'd like to go ahead and introduce our guests, if that's okay, Dr. Kane.
Absolutely.
All right. So we'll start with Miss Rhonda Ali. Welcome again. And Miss Rhonda Ali, I've known her for a long time. She's an adult living with sickle cell, and she has been an advocate for sickle cell a long time. I've been working with sickle cell since before 1995. So I've known her close to over 25 years, and so it's a delight to have you on. So Miss Ali has served in a lot of different roles. She worked at Florida State College Jacksonville. At that time we call it FCCJ, but she was the assistant to the president of the South Campus, and she also worked for the dean of social and behavioral services at Florida State College Jacksonville. She's also been a community service or customer service representative with Allstate, and she volunteers with the Big Brothers and Big Sisters. And I think that's important, that even though you're going through adversity and going through your own pain and problems, that you're still able to give to others, and that's something that should be commended. So she is currently volunteering with Big Brothers and Big Sisters, and she's also worked with Lutheran Social Services with the Dreams Come True program. And so we want to welcome Rhonda to our session today. We're looking forward to hearing from you. And again, we thank you for being a part of our show. Fredriana dropped off. Thank you. Fredriana dropped off. I'm going to go ahead and introduce her as well. Hopefully she'll be able to jump back on. Fredriana Copeland Webster is a sickle cell warrior, and she's also a survivor of neuroblastoma cancer. So she's had both cancer and still continues to live with sickle cell. So she is a fighter.
Wow.
She is an
Wow.
overcomer. In spite of these difficulties, she's currently an honors student at Florida State College, Jacksonville, and she is majoring in biomedical sciences, which is awesome because she wants to research rare diseases such as sickle cell. She is an advocate with the goal of educating the public and raising support for the sickle cell community. And she also is the host of the Richard Webster Bass Sickle Cell Teen Talk program, which is every third Sunday at 7 p.m. So she co-hosts that show. And so she's really active, and hopefully we can get the technical difficulties worked out. So I just wanted to share a little more background, Dr. Kane, about sickle cell. I know that you've seen sickle cell patients in your clinical background. We know that not only does sickle cell cause excruciating pain, we're not talking about pain like a headache, but extreme pain. I asked once a sickle cell patient to describe a sickle cell pain, and he said it's like hitting your toe against the bed, but imagine that magnified times 1,000 all over your body. So we're not just talking about a headache pain, but we're talking about excruciating pain, along with all of the other complications and medical manifestations of the disease throughout the body. And so it can affect the eyes. It affects, the blood count, anemia. It affects, the brain in terms of strokes and so forth. And so our work with the Richard Webster Bass Health Institute is really about supporting families and not just thinking about the physical effects, but also the emotional and the spiritual perspectives and the mental perspectives as well. And so we want to provide connections and supports to sickle cell families throughout our community. Dr. Kane, what has been your experience with working with sickle cell patients?
Okay, so many sickle cell patients that I've worked with has mainly been about pain, but all the parameters that you mentioned, I've seen happen. May not have happened while it was on my watch, but there was always, there were many times a history for it. Anything, like you say, from having strokes, and maybe not all the time will it be stroke, but it may affect their memories because it may not affect the larger blood vessels is in the brain, and sometimes the smaller blood vessels. And so you may have some isolated cells affected. So whatever area of the brain that is affected, you may see the adverse effects that the sickle cell or the sickling of those blood cells can cause. So memory loss, okay, vision disturbances, obviously headaches. Depending on what part of the brain it affects, it may affect their social behavior. It is very diverse because it can happen anywhere that what we call vaso-occlusive, which means the vessels get occluded, can happen anywhere in your body. And men sometimes, not sounding gross or anything, but men sometimes erectile dysfunction can be that. And so they may have, of course, then that may affect the ability for reproduction for the person who may want to start a family. And women, same thing, depending on if it affects the arteries to the ovaries and they become damaged, it can affect them as well. It is as numerous as what you said, any part of your body. You can have amputations. You can have loss of vision. You can get loss of taste. It just depends on where that sickling occurs. Mm-hmm. And one of the other effects I see from having sickle cell is, for lack of better description, is the ossification of the sickle cell patients. Sometimes when they come in with contact with those health professionals who do not understand and appreciate what a sickle cell patient goes through, especially as it relates to our emergency room. They go in and they're in such pain, and the first thing some of these people that don't understand and don't appreciate the sickle cell disease, they think they're drug seekers, and that's not what they're trying to do. They're just trying to get pain relief. And so when you start categorizing or stereotyping those individuals as drug seekers, over time that could affect them mentally and make them somewhat depressed, as you mentioned earlier, and have a lot of anxiety, makes it very anxious patients because they don't know when the next sickle cell crisis occurs. So you're always anxious. Could be, and Miss Copeland Westler, not to diminish what you're going through, but just as you're in school right now, you're preparing for a big test, and all of a sudden, at what I'm gonna say anytime is inappropriate, but when it comes down to your education, if it's just before an exam, the first thing people want to do is stereotype you as, don't want to take your exam. You want to take it. You want to do well because you know you can. But you sometimes get caught up and there's nothing you can do about it except try to be as preventive as possible, for which we can discuss what that might be in a short minute. So it's just so numerous. One last thing, I just wanted to make sure that people got the statistics. It's about 300,000 babies are born with sickle cell every year. You can only imagine. And an overwhelming majority of them in this country, for sure, African Americans. And the origin of the sickle cell disease, believe it or not, for some people, you guys probably know it, but for some people who didn't know it, it was actually a genetic mutation that occurred as a result of the body trying to protect us from malaria. Okay, and those people whom developed malaria or were in high probability of developing malaria, they were very well protected from the effects of malaria, including death, if they had sickle cells, because that's what it helped. But on the other side of that now, in which we have treatment for malaria, that's not a desired effect we want to see. However, at this time, it's in the genes, so it's very difficult to remedy that problem from just from the genetic standpoint. But that's another discussion.
Yeah. And Dr. King, I wanted to thank you for sharing the statistics. And, a lot of times people don't understand the difference between having sickle cell trait and actually sickle cell anemia or living with one of the blood disorders, sickle cell disease. And so, there are about 1 in 10 African Americans that live with sickle cell trait. And when 2 parents have sickle cell trait, there's a 25% chance of passing sickle cell on to the child. So one of the important messages that we want to leave everyone with today is to know your status. And so, yes, we have newborn screening now where every baby in the U.S. is tested for sickle cell disease as a baby. But what happens is a lot of times if they're a sickle cell carrier, they're like, oh, it's okay. And they don't tell the child later on once they become older. And so they're not aware of their sickle cell trait status. So if you don't know whether or not you have sickle cell trait, it's important for you to talk to your primary care doctor, or there are several free events where testing is done. And so, getting a test and finding out whether or not you're a carrier of sickle cell disease, because you won't have all of the manifestations that Dr. Kane has described earlier. And so you may have sickle cell trait and not even know it, right? And so it's important that we know our status. So that's one of the key messages that we like for our audience to leave with today.
One other key message I'd like to get, since you mentioned knowing your status, your status, I also know a potential partner status, someone you may decide to have a family with. You really need to know what's going on with them, because if they don't have a sickle cell trait like you do, then they're unlikely to develop the sickle cell disease. But if they do have it, as Dr. Bass mentioned, then there's a 25% chance easily that that the 2 of you guys can produce a sickle cell baby. So but just by knowing that, that's one level of prevention. That's what I'm really trying to get to.
Absolutely. Yes. And, and the other thing is that there are a lot of different variants or types of sickle cell too. And it's important for, individuals who are actually living with the disease to know what type of sickle cell they have, whether it's hemoglobin SS, hemoglobin SC. There are a lot of different variants, and the severity of the disease varies, one from individual to individual, but also based on the type of variant that you have. So when you present to the emergency room, you can speak intelligently about what you have and knowing what you have so that you can be that empowered patient when you present to the healthcare system. So I think that's important for those that are actually living with sickle cell disease as well.
Yep.
All right, so we have our guest here, and so we want to bring them into our conversation. Fredriana is a young adult and college student. I'm so proud of her at Florida State College, Jacksonville, majoring in biomedical sciences. We introduced you earlier. And we also have Rhonda Ali, who is an adult living with sickle cell, and so she is managing well and such an inspiration to the sickle cell community. And so we're delighted to have both of you on today. And so we mentioned earlier that Juneteenth is coming up, Redteenth for us in honor of Sickle Cell Awareness Month. And this is an international celebration. So Fredriana, I'll start with you. So why is it important for us to celebrate World Sickle Cell Day, and why should we bring awareness to sickle cell disease?
Yes, thank you. First, I would say World Sickle Cell Day is important for us as sickle cell warriors to celebrate, because I'm pretty sure most of us don't just set aside time to congratulate ourselves for all that we've been through and all that we're still going through. So we just deserve a celebration just for existing. And then also for others to celebrate the lives of warriors, because sickle cell is a rare disease, so it doesn't receive as much recognition as common diseases such as cancer, diabetes. So it's just important to not forget about us as sickle cell warriors and to celebrate us.
Yeah, I think that's really powerful what you said, is celebrating sickle cell warriors. I think it's important for us to recognize the resilience and the tenacity that's required to live with sickle cell. As Dr. Kane mentioned, it's like the unexpected interruptions of life. You wake up one day, you think you going to class or going to work or going to volunteer, and then a crisis hits, or a pain episode hits, or your fever is high and you need to, go check in with the doctor. So it's so important that we recognize the resilience and the bounce back factor that you all have. And you're absolutely right. Sickle cell does not get the recognition that other diseases. And so we're working on that. We are day by day, year by year, month by month, working on bringing greater awareness. And so, Rhonda, what's your take on it? Why do you think it's important to celebrate World Sickle Cell Day?
As Frederica mentioned, yes, it's an opportunity to show the world that we are here. We are people too, and we deserve to be recognized. Especially someone of my age, of being 55. I've seen a lot. It's best to get families together, talk about it, put it on the table, and make people more aware of it. Because a lot of people do not know about sickle cell. You ask questions to people, have they heard of it? No, I've never heard of it. So it's good to bring it to the table, families, communities, bring it all together so that we can get more help, and information out there to prevent this disease from going further, because it's just unfortunate that we bringing these babies in this world without knowing, just like myself, not sure about what we have, because I didn't know, for example, about my illness until I turned 19. So if we could kind of get more awareness out to families, friends, communities, we can avoid these things, So to bring it out, to let everybody know, it'll help prevent more babies being born in this situation. So we need to bring awareness. It needs to be a celebratory time, because I'm thankful for the technology that's come this far to help me get to where I am today.
Thank you for sharing.
Almost every Black baby, a baby of African descent, will be tested upon birth for sickle cell, or at some point, for sickle cell. So and most parents, so that means the those reproductive parents that we have these days, not like yours truly, but these reproductive parents we have these days that are young enough, they are have been tested at some point in their lives for sickle cell trait. Question is, passing that information on to your offspring has been the problem. They have not passed it on. So it's great for anybody that's listening that might have had trait. It's great to be tested. And then one last thing, and I'll let Dr. Bass take over, is that we have a significant mixture of races these days. And there's nothing that's written in stone that say, cause you part white, you can't have sickle cell trait.
Mm-hmm.
Yes. And so we know that sickle cell affects many races and ethnicities, mainly African American here in the United States,
Right.
but sickle cell is a global disease. One in
Yes.
16,000 Hispanic Americans live with sickle cell. So so it's not just African Americans, but we know we are disproportionately impacted here in the US. And so we want to bring awareness to that disparity and disproportionality. So, Rhonda, you mentioned also about some of the advances, and I think it's important that we acknowledge that. There are some new drug products that are out, such as hydroxyurea, Oxbryta, and these are major advances because basically in the past it was, you know, you go to the hospital, you get your pain meds, you get some IVs, some fluids, and you go back home. And so, you know, now we do have more drug products that are available for sickle cell families or individuals living with sickle cell. And we also have bone and stem marrow transplants, but that is an option not for everybody, right? So you have to have a match. And it's a very risky procedure and always not the best option for every patient. So we're still looking for that universal cure for sickle cell. And so our hope is for gene therapy. That is our hope for the future is gene therapy so that we can correct that point mutation that Dr. Kane mentioned earlier, right, in the DNA code. So I'm going to go back to Fredriana with our next question. So what is it that you would want health providers to know in terms of living with sickle cell? What would you want health providers to know?
Yep. I would want health providers to understand that sickle cell affects every aspect of life, not just the physical aspect, but the emotional, the mental, the educational, social, all those different aspects of life. And I would love if there were more resources for those aspects. Mental health resources that focus on the mental health side of having a physical disorder. I wish that there were social resources for people with sickle cell disease to connect with one another and other people who are like us and understand what living with sickle cell is like. Educational or occupational resources so that people who miss days of school or days of work can have something there for them to get through those tough times. So that's what I would want health providers to know.
Yeah. I love how you talked about, you know, sickle cell holistically, right? Because a lot of times we compartmentalize and we bifurcate, you know, physical over here and mental over here, but they're all interconnected. And I know Dr. Kane, as a clinician, when, you know, patients come in, a lot of times you don't know if you're a psychologist or if you're a physical doctor because, you know, people come in, they talk about everything because that's who you are, right? That's your lived experience. So you're absolutely right. We do need more mental health resources specifically because just managing the pain, it affects your morale, it affects your motivation, you know, it affects every part of your life, you know, and so making sure that we stay, and I always like to say strong, but staying connected and knowing when to reach out for help. I think that's really important for sickle cell warriors because sometimes, you know, we put that label on, you know, I'm Superwoman, Superman, and then we feel embarrassed when we have to ask for help. And it's okay to say that I'm not okay and I need support. I need my village, right? And so, so that's so important. Dr. Kane?
Yeah, it can be a significant, and I concur with Ms. Copeland Webster in that it affects every aspect. You know, just if you you got a job, and you know because you can't predict or you can't dictate when crisis show up. You may have a fair amount of absence. Okay. And so you also try to make sure we can find employers who can really understand what's going on with that individual. You know, how do you educate them? Sometimes people want to apply for a job and they may be reluctant to go to apply for it because they don't know how to tell that employer that they have sickle cell disease and now and that I may be missing from work. Okay. And the first thing people in that they may misconstrue or construe that to mean, oh, they just want to be able to tell me they FMLA like they want to, leave the job when they want to. But I want people who don't have sickle cell to understand and appreciate the difficulty it may be in terms of hiring a sickle cell employee. They can be some of the best employees you have.
That's
But
right.
they may not be able to, they can't dictate a crisis, with the exception of possibly some of what Miss Ali just did on this broadcast, and that is stay hydrated. I noticed you was drinking the water, and that's one thing you have to make sure. Stay
Yes.
hydrated well with sickle cell disease.
And so,
Yes.
Ms. Rhonda, for you, what is it that you would want healthcare providers to know about living with sickle cell?
First of all, they need to listen to us, listen to what we're saying, understand that they don't know our pain level. And it is sort of disrespectful when you go into the emergency room at times. They look at you all sideways and think you're just wanting to get a fix or whatever. We need more we need more people that could specialize in sickle cell disease. People that, just particularly specialize in our situation because they don't understand it. It's simple as asking for a blanket while you're waiting to be seen in the emergency room, and they look at you like, well, hold on, it'll be just a second. But they don't understand that within a second that pain level can come from 0 to 100. I mean, even worse than what you came in with. So they need to listen. So we need more training, people that understand our disease and how bad it can get in no time flat. I mean, from being too hot, too cold, whatever. Just listen to us. So we need more people that's on our team and understand where we're coming from. It's not like who wants to sit in the emergency room and wait on medication? I mean, yeah, I understand that there's some drug heads out here, but there are people that are really in pain, and you can't judge from one incident to another about what a person is going through. So we need more specialized training in the disease so they could understand and basically help us more than what they have. Because people have died behind that, if they would just listen more and give us the floor and try to understand where we're coming from without judging us, that would be good. And like I say, with the training, we just need more people, nurses, whoever, ambulance, just treat us better than they do. Don't make it look like we all the same and we're just here we're human beings as well. So we need to be treated as such, just like any other disease.
Dr. Bass, Wester Bass, we do know that many people need cultural training.
Yes.
Which I know you specialize in.
Yes.
But part of that kind of training is a subcategory is understanding sickle cell disease, particularly since there's such a high level, a high number of, a high percentage of those patients are African American. So you walk into an emergency room and you got a double whammy in terms of when you come in and people, whether it's an implicit bias or whatever it may be, as you're aware of, and the instant you say they already may have an implicit bias with your skin color, but then as soon as you say sickle cell, now it's magnified like a nuclear explosion, a mushroom nuclear explosion, and so people really need to be cognizant of their own self prejudices that they have toward the individual and the disease.
Exactly.
That is so true, Dr. Kane. And what you were describing, in my world, we call that intersectionality. So not only are you dealing with a person who is considered a racial minority, a lot of times you're presenting also as a racial minority and a woman, and then you're presenting as a racial minority, a woman, and also living with the chronic illness. And so all of those levels of marginalization show up to the emergency room. And oftentimes clinicians have implicit and explicit biases, right? Some are unconscious, but some of them are conscious, right? Some of them we've been socialized that, certain groups belong down here and certain groups belong up here. So we have these hierarchies in our head. And so it's really important, like you said, Rhonda, that we are training physicians to confront and to disrupt the biases that they may have for families because of color, because of socioeconomic status. That's another marginalization as well. Right? And so, absolutely, that training, that cultural competency training, that implicit bias, explicit bias training is so important. And it should start early on, not just once they get to their residency training, but in medical school as a medical student, right? That they're, being introduced and having that time for self-reflection, reflective practice, thinking about, maybe I do need to tighten up here a little bit and be more empathetic and a better listener, as you mentioned, Rhonda, when families come in and caregivers. So it's, depending on the age, it's not just the individual, but a lot of times it's also the parent and the caregiver that's having to, have this communication with the clinical team. So thank you all for those perspectives.
I would like to mention real quick, Dr. Bass. I want my physician comrades to know to understand, while it may not be you that have that intersectionality or the explicit and implicit bias that you refer to, be aware of your colleague who may be, exhibiting those features, so that you are aware of a patient that is being mistreated and not treated well. Intervene. You can do it politely. I've taken over, especially when I've worked in the emergency room. I've taken over care for patients that might have been being cared by another physician, and I didn't like the way that was being done. So I stepped up to the plate and said, "Okay, I take this responsibility." Because just imagine if that was your son, daughter, mother, sister, brother. If it was one of your relatives, what would you want to happen? Okay?
That's right.
And you weren't there. You want someone to step up and assist them with being taken care of properly.
Yes. And, there's lots of discussion around race and identity right now in our socio-political landscape and in the larger society. And I think it's important, that we're not trying to blame and shame people, but we are trying to challenge the status quo. And so, we've got to call it out. It doesn't mean that you have to do it in a nasty way, but you have to make people accountable, because, many of our health professionals took the Hippocratic oath. And so that's to do no harm. And so we don't want to harm our patients. We want to help our patients. And
awareness is key.
Yes, awareness is key. And so we want to address the voicelessness that many of our patients feel when they present to our healthcare systems. So what advice would you all share with other individuals living with sickle cell disease? What advice would you share with others living, and even caregivers that are facing sickle cell anemia? Okay. And I'll direct that question to Frederiana.
Okay. My first word of advice to the warriors would be not to be afraid to make simple lifestyle changes. Maybe not simple, let me not say simple, but lifestyle changes in order to better your health. I recently became a pescatarian, which is like a vegetarian diet, but adding seafood. And I've been a pescatarian for about 3 years now, and I love it. It has really given me more energy throughout the day, and I barely have sickle cell pain episodes anymore. And in addition to that, I also want to say, don't be afraid to try different treatments that are out there for people with sickle cell. As was said earlier, there isn't a universal cure, which I hate, but there are treatments just to make living a little better for us. So I'm on Adakveo, which is a treatment that is used to reduce the amount of sickle pain episodes and the severity of the pain that we experience. So that has been like working a miracle on me, and I haven't been hospitalized since I started getting that treatment. So don't be afraid to try new things. And for yes, and for the caregivers, my advice would be just to be understanding and tend to the needs of the individual that you're caring for. I'm 19 now, so I'm pretty independent and I know how to take care of myself, but I do need certain things from time to time. If I'm having a rough patch, for example, I might need a drive to the emergency room, or I might just need one of my siblings to go and get me some Gatorade from the Dollar General or something, just so I can stay hydrated while I'm not feeling well. And it just helps so much having that support system there when we need it.
Yes, thank you so much for that. It does take a village. We say a child, but it just takes a village, period. We're adults and we need a village. Everybody needs a support system.
Yes.
And so I love what you described, your siblings helping you out, but even extended family. Not all family is biological. We have, non-biological family too, our church family, our friends at school. And so it's important that we sometimes create that village for ourselves so that we're not out here fending alone. And so that's awesome. So thank you for sharing. What about you, Rhonda?
Well, for the caregivers, they need to listen to their whoever they're taking care of. Pay attention to what they're doing. Make sure they're taking their medications. Make sure they don't miss their appointments. Have conversations with the patient or what have you, and just kind of stay in tune to what's going on, because kids or whatever, they get excited, they don't drink water like they should. So as parents or caregivers, yes, we have to make sure that we stay on top of those kids to keep them out of the hospital. And excuse me, but what was the next question? What was the other question?
That's fine. So for adults living with sickle cell, what would you say to them in terms of advice?
Speaking to myself, just to make sure as well, keep those appointments. Don't be afraid to talk about what you're going through, what you're feeling. If you have some advice on what's going on with your treatments or what have you, just be an advocate for yourself. And just really pray, trust God and just follow your heart. But mainly just do what you're supposed to do. That'll help your situation. If you feel uncomfortable about things, bring it to the doctor's attention, and again, we need support groups, people we could talk to, friends, family, whatever, to help us to kind of continue on, because it's a tough journey. I have been on a tough journey, and thank God for Jesus for allowing me to be strong in my own right. That's why I'm here. I had lost my son, I lost my cousin, oh God, to this disease, and I'm trying to be an advocate for them as well. So I want the best for everybody. If I can help one person out, I would love to. And that's what it's all about: talking about it, speaking about it, sharing it, bringing it to the table. Don't be afraid or ashamed of the disease, because some people actually make fun of it. I've seen people making fun of the disease, which is not fun at all. So this is serious, and if we can get to the bottom of it by sharing and talking, bringing it to the table, it will make a big difference in everything, I think.
Yeah. Rhonda, you said so much there. But as a minister, the thing that I really honed on it was prayer, right? And
Yes.
connecting with something greater than ourselves. Connecting for me is Jesus, right? And for you is Jesus. But the importance of having not only connection with the village, but connection with God, because it gets really tough. I made it through COVID, and that was tough, right? And so I know it's no comparison to the ongoing experiences and pain that you all have in terms of living, through and with sickle cell. So it is important that we are drawing upon our spiritual strength and our spiritual source, while also speaking up, being our own advocates. That's critical, right? And connect with family and connecting with community. And in fact, that's one of the reasons why we started Teen Talk with Fredriana, who's the host of that. And then Rhonda is our guest on this Sunday, right? Yes. So that they can have their own space, because teen issues are very different than adult issues, right? And so,
Definitely.
so that's part of the reason why we create a space just for teens and young adults to talk about, what they're facing and tips, to use in terms of hydration, in terms of even how to use your phone during your
Mm-hmm.
appointments, right? Writing things down in
Yes.
your notes on your phone so you can remember when to
Mm-hmm.
take your medications, what your next step is. So they have all kinds of tips that they've shared in their Teen Talk sessions. And I'm really excited that we are launching next month a parent support group, a virtual parent support and caregiver adult group, July 15th. And so we're creating a space not only for our young people, but for our adults as well, because we know that they need a space to talk about their experiences and talk about, how to stay encouraged and how to keep moving forward. And when you fall face down, how do you get back up again?
Mm-hmm.
And so
Mm-hmm.
it's important
Absolutely.
we have
That's,
that network. So thank you all for that. Dr. Kane?
Well, I can relate to the concern that we all have, um, that we all have, as in terms of people being aware of what's going on with us, and I want to make sure also people be aware of what's going on with yourself, and that may be a need or a market for us to try to get some type of a device, because I know it happens. I can't tell you how frequently, but just like the personal alert devices that we have for senior citizens, that we need to have something for our sickle cell patients when they get in quick trouble, that they can alert someone, because not all the time are they able to get to the phone or get to a place where they can contact people to get help. And so that would be very nice for the medical industry to at least expand the use of personal devices like that. Also, I think they need to expand the use of telemedicine with sickle cell patients, because as Ms. Copeland Wester said, you have to depend on people to get you transport to places and or
mm,
assist you with some of your needs, as in, she used the example of Gatorade. But if we had some type of if we improved our telemedicine treatment programs, and that's on the insurance company, so we need to kind of address them about that, and so it's more accepted that we can treat these sickle cell patients and not have to have them try to come in, because it's difficult. A lot of them don't drive because of the potential complications that they may experience while driving, okay, or whatever it may be. I'm not saying that they should be prejudicial and don't allow them to drive, but sometimes they can't get transportation to where they need to be. So we need to have a better system in place to be able to accommodate the needs of our sickle cell patients.
mm.
Yes, I love that idea about a device. That's novel. That's important. I recently worked on a telemedicine study focused on people living with HIV and AIDS, and one of the things that the patient said is that telemedicine offers such convenience. I don't have to, one, transportation, as you mentioned, I don't have to worry about that. I don't have to take off from work. I can just go in the break room and do my appointment. I don't have to worry about childcare, in terms of making arrangements for my children. I don't have to navigate the healthcare system, right? So they had a lot of facilitating factors, in terms of why they were using virtual visits. And then in terms of hindering factors, some of them said that they just wanted to be in the same room with their doctor. They needed to see them eye to eye, face to face. And for others, there was the concern of privacy. Not everybody trusted technology in terms of security and so forth. So some different perspectives on that. But definitely, I think COVID has really changed the way that we're doing medicine. We're now more open, and there's reimbursement now for telemedicine, prior to, we didn't have the reimbursement that we have now. So I think that's definitely at least one benefit we got out of COVID-19 as we continue to navigate the pandemic. So
should have been in place a long time ago, but
that's right.
we can take what we have right now and move
Yes,
forward.
absolutely. So what are some of the mental health and coping strategies that you all use in terms of maintaining your well-being? And I'll direct that to Rhonda.
Number one, my Christ and Savior. I have to pray and ask for my strength every day. Every day, that comes first for me, and that's giving me the strength I need to get through. Because again, it was my son and I for a long time, and just being able to, we go back and forth helping one another, and to lose him in the process of all of this with COVID and this, that, and the third, it's like life happens and you just have to put your best foot forward. And in order to get that foot out the door, I have to have God in my life. And so that's what's keeping me coping. And again, I have a few family members that has the same issue. So just being able to touch base with someone that's in the same situation helps me to maintain as well, just to talk about things at times with my friends. And living, I have to get out. And if I can't help the next person, that's another thing. Mentoring helps me to get through, because it's giving me the opportunity to share my love with someone else. I feel like I'm doing something other than dealing with this illness in itself. A lot of people are not aware of how consuming this illness could be. And again, like the doctor said, we don't know when a crisis is going to occur. We can do the best we can to stay out of the hospital, but we just never know how our body's going to respond to certain things. So it's a struggle. So with Christ in my life, it makes a big difference. And so that's how I cope, mainly, and helping others. It does wonders. So it keeps me on my toes.
Awesome. Thank you so much for sharing, Rhonda. What about you, Fredriana?
Yes, as Miss Rhonda said, you definitely have to look to God, to a higher power, because that's really the main thing that gets us through these tough times. I'm definitely working on improving my coping strategies at the moment, but I'll have to say music, that's definitely something that I always go to no matter what. Some good soul cleansing music is always there. And also exercising a little bit. I know scientists say that exercise has been proven to increase happiness, or so they say, something like that. So I always exercise, especially when I'm angry in particular. I know it kind of sounds crazy, but we're human. We all get angry. So I just kind of work out my sweat. I work out my anger and I just sweat it all out. And then also having time with my friends definitely just allows me to know that everything's going to be okay, and that I can live in the moment, and that, I'm going to get through it.
Wow. Wow.
At the risk of sounding violent, exercise does work. But I got a punching bag hanging in my garage. Me and that punching bag go at it.
Yeah, I was so funny. My devotional this morning was on managing anger. And so, Rhonda, when you were talking about the grief and the loss of your son, and I have that commonality with you in losing Richard. And I remember going through the anger stage. And in my devotional this morning, it was talking about, or, it listed ways that you could deal with the anger. And one of the things it said is just being very honest with God about what you're feeling, just letting it all out, right?
Yes.
And finding a friend or someone to talk about with it, or writing a letter where you can just write down everything that's, really just eating at you, and just, the pain of feeling that it was unjust in some way. So, so it's interesting that you mentioned the grief, and then Fredriana was talking about the anger. So that just, brought about, and then of course, Dr. Kane talking about the punching bag too, right? So absolutely. So great coping strategy. So exercising, because you're releasing those wonderful hormones, right? Your endorphins and oxytocin, all of those great hormones that help us to manage our stress and to boost our energy and boost our positive thinking. You also mentioned friendships, music, right? We do a lot of education around mental health in the community, and music is one of the tools that we use because it shifts your mood, and so it's a real powerful force in terms of helping us to manage our everyday lives. And then certainly mentoring, so giving back. So even when you're going through your own stuff, but just finding ways to give back to others. And I know both of you give so much to sickle cell and to other causes as well. So that's absolutely amazing. And then finally, and certainly not least, is our spirituality. That is an important tool in terms of us, maximizing our greatness and being our best selves. We can't do it unless we have that connection. And so thankful for that. So, Dr. Kane, I'm going to turn it back over to you. This has just been a wonderful discussion. We're so excited about Redteenth, Juneteenth, June 19th. And just to also mention, we're partnering with the Martin Luther King Foundation on Saturday for their Juneteenth parade. It's being held at the historic Mount Zion Church right there at New Kings Road and Myrtle Avenue. And so they're having a parade. And so we'll be out there with our sickle cell information and tabling and our banner, bringing awareness to sickle cell. And so we're really excited about that. And then we have our Teen Talk on Sunday night with Fredriana and Rhonda. And so that's at 7 p.m. And we are launching our parent and adult support group next month on the 15th. So we're really excited about what we're doing in the community. And we appreciate the opportunity, Dr. Kane, and also Jocelyn in her absence for allowing us to be part of Pause for the Truth tonight.
Well, I would very much like to thank you ladies for participating in our program. And as we do on a regular basis, at the end of each show, we give each of our guests an opportunity to make a statement as to something that they would really like to get across to our audience. So we will start with the youngster. Oh, let me see which one that is. Miss
It's me.
Okay. Only because I was told by Miss Webster Bass that you're the youngster. So, Miss Copeland Webster, we start with you.
Okay, well, I would like to leave everyone tonight saying that there is a rainbow after the rain. And that is a motto that both my aunt and my father, yes, that's the Rainbows book, authored and co-authored by my aunt and my father. They reminded me of this statement with this wonderful book and also a song that they made together talking about my life story, having sickle cell disease, but also my aunt's son, his story, having sickle cell disease. And I just want everyone to know that we're going to get through this. There's a rainbow after the rain. So don't give up.
Very good. Ms. Ali?
Whew, that's really deep. My situation is just wanting to be an advocate, help whoever that needs help with this disease, from speaking, just being there, support, whatever I can do. I have a son that I've lost and my cousin that I lost, and there are many other people out here. But I want to speak up. I want to talk about it. I want to put it on the table. I want to spread it and let the world know we need to handle this situation and just love on one another, respect and this disease as other diseases that are out here. So just to get the word across to everyone that we need to take care of this the best way that we can by coming together.
Well, thank you, Miss Ali. And Dr. Webster Bass.
Thank you, Dr. King. So there are two words that I want to leave with our audience and with you, Dr. King, because I'm also going to have an ask with this. Those two words are joy and justice. Joy and justice. And so the work that we're doing is really about bringing joy to the families and those that are facing sickle cell day in and day out. That is really the heart of the work, is to bring joy to their lives. And so that means that, one, we need a universal cure for sickle cell. The second part is justice, and that connects to what we were talking about earlier in terms of the way our patients are treated when they go to the emergency room, the way our caregivers are treated. It's important that they're not discriminated against. It's important that we that we don't cultivate the sense of voicelessness that they feel when they present to our healthcare system. And so in September 9th, we are launching our annual Sickle Cell Conference. We do a Sickle Cell Conference every year. We've done it for the past 5 years. And the name of the conference that God gave me this year was Joy and Justice Sickle Cell Symposium 2023. And so we're looking for partners to be a part of that conference. We love for the Northeast Florida Medical Society to be a part of that. It's scheduled for September 9th, 2023. And we've already gotten the First Coast Black Nurses Association on board. And so we'd love to have also the Medical Society to be a part of that as well. We already have opportunities for continuing education credits for our nurses, for our physicians. And so we'd love for you, Dr. Kane, to be one of our co-partners in your organization to join us in bringing joy and justice to our sickle cell community.
Well, I thank you, and I appreciate the offer and opportunity to do such. I will be putting it to my physician group, not only the Medical Society, but the Medical Society Foundation. I would encourage you to leave for us to place on our website about the whole conference so people can have access to it. It's the one thing about about Pause for the Truth. For people who missed the program, just FYI for you guys, for people who may have been busy studying for finals or something along that, who may have been busy with their everyday lives, there's always the opportunity to go back and take a look at this program because it's always available on our website as well as the other many programs. Well, and so we're more than welcome. We're more than happy to participate in that. Okay. So, but since I'm not so astute about some things, technology, I'm going to leave it up to you to get it to us. Okay.
Yes, we will.
Not wrong. We'll put it on. I'd like to leave with saying just a few things. I really like the idea about advocacy, but I also want to encourage advocacy from all different directions, physician advocacy, family advocacy, advocacy from all various aspects of society and include self-advocacy. So you guys are doing okay, but I want to make sure that all sickle cell patients remind themselves that they need to advocate for themselves as well as anybody else will advocate for them. So don't forget, advocate for yourself and have no shame about it. Okay. All right. The other thing is for relief, I use comedy for a whole lot of relief. In my patient, people come in my office, and one of the things they're doing, like, why are you guys laughing so much in the other room? It's because laughter is an excellent therapy for many things, just like prayer, and can help get you respect. And when you can look into yourself and other people and have something to smile about, it's a great panacea for relief of your stresses. So do that. Also, I want to make sure that people remember that sickle cell trait can cause, even though most people don't think about it, sickle cell trait can cause death under certain circumstances. So you don't have to have the disease. You can just have the trait. And one of the primary examples was that Florida State player, big guy, 6'3", 200 and some pounds, died out on the practice field because he got dehydrated. And the sickling took place. So we want to make sure people appreciate sickle cell trait as the potential dangers in sickle cell trait as well. Want to remind people that Juneteenth is coming, Redteenth is coming, and we also want to make sure that people remember to support their local Black entrepreneurs with the Juneteenth event that's on A. Philip Randolph. What is this Saturday, I think, coming? Yeah, not this Saturday, coming when they will be out with vendors lining all of J. Philip Randolph. You guys, if you can, bring your message. I don't care what you want to pass out. Bring it and just make people aware about Redteenth as well. And with that being said, I want to thank all of our guests for their commitment and for their um, passion with trying to help others. Because you came on this show not for self-advocacy, even though I just advocated that. You came on this show because you wanted to help others. Okay, and we really appreciate you stepping out and talking to others. And so we want to thank you guys very much. We will
Thank you
be
for
back.
having me.
Hope you guys can come back at some point in time. And with that, I would like to say, go out, support your Sickle Cell Foundation, support this advocacy for Redteenth, and we very much would appreciate that you join us next week on Pause for the Truth, because you will get the truth.
Amen.
Thank you so much for this opportunity.
Thank you for having me.
All right, thank you guys. Everybody have a good night.
You too.
You as well. Thank you.
Bye-bye.